Good morning to Miss Fiona. I'm Ellen. Today I'm going to present about my research topic that is importance of knowledge and awareness about diabetes among university students. And here are the contents I'm going to cover about is introduction, purpose statement, research question, significance of study, definition of terms, literature review, methodology, data analysis, findings, conclusion, and lastly, design direction. And diabetes is a disease that affecting people of both genders and across all age groups, and is currently considered a major public health challenge worldwide. So, how diabetes? Diabetes mellitus DM as a short form is a chronic health condition that affects our body's ability to turn food into energy. Basically, the body breaks down the food into glucose which enters to our bloodstream. So when the blood sugar levels rises, our pancreas will produce insulin to help cells that could not produce enough insulin and result in excessive sugar in the bloodstream. And this research aims to investigate the critical of deficiency in knowledge and awareness about diabetes among university students, and also to advocate for the implementation of effective education tools and awareness initiatives that empowering students with the knowledge and to prevent this chronic health condition, hence safeguarding their well-being. And the first research question is, what are the underlying factors contributing to the lack of knowledge of diabetes among university students? And the second is, how does the implementation of effective initiatives and educational tools can empower university students with comprehensive knowledge of diabetes? And this research study addresses a huge gap in knowledge and awareness of diabetes among university students and also provides a wide view of diabetes complication and raising awareness by empowering students with the knowledge about diabetes, allowing them to live healthy. And here are the definition of them throughout my research study process. First, diabetes mellitus (DM) is a disease of inadequate control of blood levels of glucose. And secondly, prediabetes is a condition which our blood glucose levels are very higher than normal but are not enough for diagnosis of diabetes. People with prediabetes are at an increased risk for developing type 2 diabetes. Type 1 diabetes is an autoimmune disease, which is a type of disease that causes the body to attack itself, and the body are unable to produce insulin properly. With the issue, the immune system has harmed the insulin producing cells in our body. So, type 1 diabetes is a more commonly diagnosed for young people, although it can be developed in adulthood. Next, which is the type 2 diabetes. So our body has become more resistant to the effects of insulin. This also means that our body needs more insulin to get the same effects. As a result, overproducing of insulin will happen to maintain the level of blood glucose level. After a long time of duration, the insulin producing cells in the pancreas will causing burnout, and this diabetes stage can affect people at any age. This is the literature review. So the first subtopic is diabetes as a precursor of chronic health conditions. According to Dr. Ikram Ismail, he highlighted the potential for diabetes to lead to major health complications such as kidney and heart disease, stroke, blindness, and nerve damage, among the others. He also added that severe diabetes cases may necessitate leg amputation and dialysis treatment for kidney illness patients, and this statement is from CNA 2023, and the above statement have strongly emphasized the role of diabetes in exacerbates the risk and severity of long-term complications. And according to a news report by CNA, the CEO of the National Kidney Foundation (NKF) Kosinyu highlighted that diabetes is the biggest contributor to kidney failure in Malaysia. It was also reported that there are 52% of new patients that require dialysis treatment in last year due to diabetes-related kidney issues, and this also picked from CNA 2023. And this above report have underscored the very critical impact of diabetes on kidney health in Malaysia. Diabetes emerged as the predominant factor contributing to kidney failure, accounting for more than half of the new dialysis patients, and primary mechanisms including the hypertension and progressive kidney damage leading to ESRD. And next, which is the importance of diabetes knowledge among university students. According to Kobe, illness perception and diabetes knowledge are also very important determinants to diabetes self-care practices. And several studies reported that knowledge of diabetes is very poor in underdeveloped countries and also rural countries, and the knowledge should be improved through continuous education by healthcare professionals like pharmacists, nurses, and physicians. And this from Palanisamy 2013. And diabetes knowledge influences the well-being of uni students, impacting factors such as physical exercise, dietary choices, and health status monitoring. However, the lack of knowledge lead to misconceptions of illness, contributed to poor awareness and ineffective diabetes management practices. And this is the methodology. First, I use qualitative and quantitative methods for my data analysis. And first, I'm going to talk about the interviews. So, interviews were performed on site by Dr. Tong Wen Ting, a researcher expert, and it was another interview will also perform online using Microsoft Teams platform. A Sunway University student who having a diabetes family background. And second, I use Google survey form to collect the data. And electronic survey using forms was distributed targeting to 40 uni students at Sunway University for 3 weeks time from week 8 to week 10. And Dr. Tong is a very well-trained implementation researcher who obtained her PhD from University Malaya in year 2021, and her doctoral research focused on developing an effective implementation strategy to integrate patient decision aids into primary care practice, diabetes. Her insights and knowledge can lend the accuracy and credibility for my interview. Having her could also help to guide the audience on preventive measures and for the future innovative options. And why I choose Arwin, which is my classmate, and because he has a diabetes family background and his understandings and knowledge could be very able to help my research topic, and he can provide some new information which I'm not aware of. He also provided his own personal experience of diabetes, which also demonstrates credibility. His personal view can resonate with other young patients, offering peer support. He also have shared his insight on his role experiences that having a diabetes patient in his family. And here is a data analysis interview from Dr. Tong. She found out that patients' glucose level is were under an uncontrolled state even they have been on oral diabetes medication for a long time. So she came up an idea of patient decision aid (PDA) to help patients to make decisions, wise decisions on usage of insulin. So PDA is a form of booklet that includes diabetes and insulin information, allowing patients to go through and discuss with their doctors and eventually making a wise decisions. As a result, this project came up very successful. And student Alwin's grandfather was diagnosed with diabetes in 50s, causing by his grandfather consumed Coca-Cola drinks after sports. And Alwin is very aware of diabetes symptoms of blurry vision, dark patch of skin, feeling thirsty, and frequently feeling hunger and urination at nighttime. He reduces sugar intake by switching from 3-in-1 coffee to black coffee without any sugar and did some daily aerobic and basketball daily exercise. He prioritized that insulin is a big factor that will affect students' lifestyle, and he also shared about peers can exercise challenges together, helping each other in controlling their body diet. And these the results from Google survey. And results students share the common symptoms of diabetes. So as a result, most students stated that they feeling hungry, tired, and the wound is not easy to cure on the symptoms of diabetes. And some students also have shared about having severe weight loss and kidney problems with yellowish and frequent urination are also diabetes symptoms. And most students share about unbalanced diet is the big root cause of diabetes, and they also think that good habits will treat diabetes. And this the results of students shared about type of exercise. So first, some of them will suggested that they were running in the past years and they do dancing, walking, cycling, jogging, basketball, sports, gym routine, and swimming, and lastly home workout. And this the result of students suggested about how to treat diabetes by doing the self routine and launching the health checkups and health campaigns and about diabetes campaigns, invite doctors or professionals to hold a talk and design diabetes booklet and share among students and their peers, and launching diabetes workshop quiz, interactive booths, social media rollout and materials, and also collaboration with social clubs to spread awareness. And also for self routine, they also suggested about consume less sugar in their meal and their diet, and also hold a wake up exercise daily. And now I'm going to talk about the findings. So first, I'm going to talk about the interviews. And so the interviews have emphasized that a lack of promotional activities among university students is a root cause of diabetes. And most promotional efforts target to the older individuals and leading to neglecting the younger generation. And second is the Google survey forms. A significant majority of 62.2% of students believe that technology, particularly health apps and online quiz, could help to manage diabetes. Online apps and social media could offer a wealth of info and community support, empowering them patients with knowledge and connecting them with others to manage diabetes. And here goes to the conclusion part. So to answer the first research question, study has shown that students know about diabetes, however they remain silent when they were asked about more deep about diabetes. And to answer the second research question, study also revealed that implementation of effective initiatives and educational tools could empower students with diabetes knowledge by school campaigns and health checkup at educational institutions. And here goes to the last part, which is the design direction. So first, which is the interactive components. So I can add colorful and engaging designs for quizzes and surveys, the interactive surveys, like the paper for I can print out or I can do it digital that can capture students' interest and effectively test their knowledge about diabetes. And secondly, I can design a two-color palette painting in the university by incorporating healthy lifestyle elements and diverse student experience their lifestyle, how they live their life and their family, and diabetes education into the design could enhance the awareness about diabetes among them. And by using a color palette of blue and green in the artwork, because so why I use blue and green, because it's represent about diabetes healthy lifestyle, and this actually can evoke the engaging and positive feelings, making the content more appealing to Sunway University students. Thank you.